Welcome back to another episode of Board Bitesize. Today we are joined by our Chief Executive Tracy Allen and our Chief People Officer and Deputy Chief Executive Darren Tidmarsh. They will be reflecting on the most recent board meeting with a particular focus on the 4 pillars of our organisational strategy: people at the centre, working in partnership, healthy communities and focus on the future.
So Darren, we've just finished our board day. We had a private session this morning and then the public board this afternoon. Julie, our chair's got quite a lot on. She's moving house in a couple of days' time, so she's had to rush off. But we covered quite a lot of ground today, as always, and our discussions were themed around the 4 key parts of our strategy. Lot of what we've covered today was focused around people, our people, colleagues who work in DCHS and our communities. Did you just want to pick up the strand we had around working in DCHS? Because we had a very powerful staff story, didn't we?
Yeah, we did, Tracy. We had a story from one of our physiotherapists and the story was around how we probably hadn't been able to support her as well as we would have hoped. That the reasonable adjustment passport scheme had probably been not as effective. And I think my key takeaway from this was around the balance of complying with the technicality of law and taking a people-centered approach. And I think one of the things that Emily challenged us was that, consider the individual in all of it, be kind and compassionate in thinking it through.
Yeah, and it really brought home the difficulties that people right through the organisation have got juggling competing pressures. So demand's outstripping capacity in lots of services. We're under financial pressure and we want to work with all our colleagues in a really flexible, person-centred way. And I thought the story just brought home how difficult that is. And I think we recognise that there's still more we need to do across the whole trust on giving managers particularly better support in terms of training, tools, frameworks, advice to support them with juggling what can often seem like competing pressures.
I would agree. And I think, the theme of the day, wasn't it, of that balance of complexity of dealing with pressure, but looking after our staff. And I think some of our non-exec colleagues recognise that.
Yeah.
What about the theme of working in partnership then, Tracy?
Yeah, I mean, we had a couple of things there. So we were reflecting back. Last time we met as a board, we spent the morning before the board meeting with about 30 different voluntary sector community organisations from across Derby and Derbyshire, because we really wanted to understand from them how we could work with them more effectively. And we had a very lively conversation. They were constructively challenging, weren't they? Gave us a lot to think about. So this month, we were reflecting on the feedback from that, the evaluation and the feedback. There's a lot of potential to work in partnership more effectively, to make a bigger difference together to people in Derby and Derbyshire than we can separately. And we've got a lot of ideas. We now need to take some time to reflect and prioritise how we capitalise on those opportunities. So we said today, didn't we, that we're going to work with our senior leadership team across the trust to look at ideas about where we start, what we prioritise, and we're also out asking those voluntary sector organisations as well what they think they could do. The other partnership theme, obviously, was us welcoming in formally at the public board the 169 colleagues who've joined us from Derby City Council in the new Community First service. I know lots of us have been out and about to meet those new colleagues, and they're so enthusiastic, and there's such a lot of potential now to work differently, develop much more consistent approaches to how we do things, to make a bit be more than the sum of our parts. It's like the voluntary sector debate. And particularly now, I think we've got huge opportunity. We've got a brand new professional group within the trust with quite a large number of social workers joining us, and they've got some really interesting experience and perspectives to share.
And I think then we kind of went on to consider, the kind of the healthy communities kind of theme. And I suppose that's about everything that we do within
You
the
do, yeah.
organization. And I suppose at this point in the year, it was about considering our performance in last year's 23-24 operational plan. And I think the board recognized, the huge contribution of all of our colleagues. We did extremely well, in the complex kind of, situations that we found ourselves throughout last year. And obviously we formally signed off our 2024-25 operational plan and set out what we're trying to achieve this year for our patients and our communities.
Yeah, absolutely. And then finally, looking to the future, there was a couple of things I think we should highlight there. We did this morning have a very detailed session that Dean Wallace led about the incredible work, again in partnership, that teams within DCHS have done with local authority, voluntary sector, to improve discharge and flow, and some really exciting opportunities to build on the community first work in Derby City, and also move into a much closer integrated working with Derbyshire County Council. So I think that was really good. The other future focus bit, I guess, came up because we did have to talk about the fact that the real pressures that our UTCs, our urgent treatment centres, are under at the minute. And very unfortunately, we are having to take some urgent business continuity actions today to consolidate services in the south of the county because we're really struggling with capacity and demand. It's not a great position to be in. We're very sorry to the public, but we have to protect patient safety and our colleagues, don't we? I guess the future bit is that we need to stabilise things now really quickly, make sure it's safe, make sure that our colleagues are safe. We've then got to start working more effectively, I think, with other partners about what is a sustainable, resilient model going forward. How does it fit with general practice, same day access, urgent and emergency services at the big EDs? It's a hugely well used and popular service. And we know that our consolidating at the minute for a few days is going to have an impact on people in the south of the county. We're going to have to look with a much more medium to long term plan, aren't we, about how we make sure we can shore that service up in a resilient way.
Yeah, absolutely.
That's all for today's episode. Board Bitesize will be back after the next public board meeting. Thank you for listening.